Hey guys, so in today's video, I wanted to kind of vent a little bit about my frustrations at work recently. Um, so if you guys couldn't tell, I am back at work. Today is Monday. I actually worked urgent care yesterday, um, but I just didn't film anything. I was watching TikToks before I went into work. Um, but yeah, so lately I have been really struggling and really drowning working urgent care, and I have been so extremely frustrated because I'm the type of person who will go out of my way to help anybody who I see who is struggling or like drowning. And like lately, urgent care has been ridiculously crazy. So there are typical days during the week where urgent care gets crazy regardless. Like Mondays, a lot of people, for whatever reason, they choose not to come in over the weekend, even though we are open every single day of the year. Um, they choose not to come in over the weekend, so they will come in on Mondays, days after holidays. Even though we are open on holidays, people will still come in the day after a holiday, and they will, you know, kind of flood the urgent care. And my frustration is like, it's not that the other nurses at the clinic are busy. Like, I would completely understand and be quite a bit more understanding if they were busy. But what really irritates me is the fact that a lot of them see me running around like a chicken with my head cut off, and they are literally just sitting at their desk talking or eating lunch or literally doing nothing. And it really irritates me because like I said, if any of them ask for help, I literally do whatever I can to help them. I will go out of my way to make sure that everybody has what they need, that like if somebody doesn't have time to room a patient, I will go room a patient for them. And like there have been multiple times over the last couple of weeks where I've had like 4 patients showing up at the same time, and obviously I'm going to room a patient for the provider to see before I go do an allergy shot, because allergy shots don't take a long time. Yes, they do have to wait for 20 minutes after they get the injection, but they don't take a long time, and it's a nurse visit. Any single nurse is able to do that. So what really drives me crazy is when they see me running around like crazy like that, and there's allergy shots there, there's B12 shots there, there's people there for nurse visits, for like suture removals and things like that, and nobody is offering to help. Like there was a point where drug reps had came last week and they brought food in for everybody, and like honestly, everybody except for me was sitting there eating. Like the amount of times last week that I did not get a lunch break was totally and utterly ridiculous. And like, it's not that I couldn't have gotten a lunch break, but nobody wanted to cover me. Nobody wanted to help me out. Nobody wanted to room a patient or grab an allergy shot or do a suture removal really quick. Everybody was too freaking worried about sitting there eating their lunch to offer me any help. So at one point I got so extremely frustrated because one of my coworkers was like, "Are you gonna be busy in a minute?" And I'm like, "Yeah, I would like to eat my freaking lunch at some point." And I think it kind of shut her up, but she still didn't offer to help. She still didn't help me out with anything. And so I was like really frustrated at that point, and I was like, at this point I don't know what to do because I'm so irritated. And so like there was another day where again everybody was eating lunch, everybody was talking amongst themselves, and like I had multiple patients showing up because for whatever reason in the urgent care, people love to show up right at noon. I don't know if it's like people who are working who like all of a sudden they go on their lunch break, so they come and disrupt mine. I don't really know what the case is. However, I was so irritated because everybody was sitting down eating their lunch, and meanwhile I've got nurse visits there waiting, I've got patients there waiting to be roomed. And so like at one point I stood up and I said, "Does anybody have time to do an allergy shot?" And I said it just like that because I was irritated. And they all just kind of looked at me or didn't even acknowledge that I said anything. And then they just went back to like having their little conversations and talking amongst themselves. And so, like I said, I am extremely irritated and frustrated. And it seems like the people who work hard are the ones that get punished the most. And I was talking to the one nurse practitioner who was covering urgent care yesterday about this, because I'm like, you know, the amount of times that I have gone above and beyond for my coworkers or covered a shift, like even when I was working in the sleep center, I would still have clinic nurses asking me to cover one of their shifts. Before I switched back to working in the clinic again, I would have people asking me to cover their shifts, like if they had to go out of town or needed the day off at the last minute. So it's extremely frustrating. And like, I am very, very tempted to just not help them with anything today. And they are just going to have to understand that I have an appointment and I could be gone for an hour for this appointment today. There are supposed to be 3 of us covering the urgent care today, which, you know, there's only one provider in urgent care today, and I really don't know what to tell them other than like, I can't reschedule this appointment. It is important. It's an appointment with my dietitian and the exercise physiologist, because today is the day that I am 6 weeks post-op. And so like, I'm supposed to be transitioning to the next diet phase. And, you know, I'm really, really frustrated at this point. Like, I am trying to like do my best for the patients and the providers. And like, I hate when people have to sit out in the waiting room and wait just because people are lazy or don't want to do their jobs. And like, I don't mind getting up and moving, because ever since I had my surgery, like I feel the urge to move quite more frequently than I did before. And I kind of just hate sitting there all day and trying to find something to do. Especially if I've made like all of my patient calls, and then plus a lot of the nurses that are sitting there at their desks all day long, I've made quite a few of their calls as well. And so it irritates me like when I am done doing all of those things and there's really nothing else for me to do. So yeah, but anyways, it is 7:20. I'm going to try to give myself a little bit of an attitude adjustment before I go into work, because if I go into work with my attitude being like this, it's not going to be a good day. And I really need it to be a good day. So anyways, if you are curious about my 6-week post-op update, I will probably film that video before I go into work, so right after this one. But anyways, stay tuned for that, and I will talk to you guys in my next video.